symptoms, we ask that they call ahead. If they have a primary care physician or another resource that's available to them, we have online resources for them at our Banner Health website. Please do call. If you're able to call ahead, you can do some screening with those that will be able to answer the phone and get some specific direction. If anybody needs or is directed by us to come to one of our places where we provide direct care, whether that be a clinic where the primary care physician is, urgent care or emergency department, one of the most important things they can do to make sure that they don't infect one of our healthcare workers is to put a mask on immediately upon entry into those areas. By masking themselves, they will reduce the likelihood that they're going to infect one of our healthcare workers and help us make sure that our healthcare workers remain healthy and able to be at work so that we can take care of them.
How will you equip your telemedicine facilities and devices?
Thank you for that question. So we have tele capability for a number of our different service lines. During this time, we are partnering with other providers of teleservices that can help. In addition to calling your primary care physician, you can access those teleproviders for additional screening. There are many, many people who are going to get this illness. Approximately 80% of people who become infected with the virus will have mild symptoms. These individuals can likely be cared for at home, monitor their symptoms, and not even need to come in and get direct services. Tele activities or other screening like that will help those individuals do those activities so that they don't need to come into urgent care, emergency department, or a clinic appointment.
What about the people who do get really sick? What happens to the body as a result of this virus, and how is Banner planning to treat them?
So this COVID-19 disease is similar to other respiratory illnesses. Approximately 20% of individuals who do become infected with the virus will get severe symptoms requiring hospitalization, potentially ICU care, potentially ventilatory support. At this time and through everywhere else in the world, we know that there is no specific treatment for COVID-19 illness. It is treatment of ongoing support and treatment of the symptoms. So we will continue to treat those individuals in that fashion that have severe symptoms in the way that we do for other respiratory illnesses, through hospitalization and other support mechanisms. There is no other treatment for that. There's no drug treatment for this. It will be continued supportive care.
How do you plan for staffing if staff members, doctors have to go into quarantine? Can you talk us through the plans for that scenario?
Yes, absolutely. So Banner Health, as the largest provider of healthcare in the state of Arizona, has been planning for this for a number of weeks. We have a number of contingency plans that we have put into place and that we will continue to put into place as the situation requires us. It's a very fluid situation. We are meeting multiple times a day to assess what our needs are, which includes staffing. For those individuals who may have exited out of the workforce, we will be redeploying them to take on some of the burden and some of the activities for frontline and other activities that will help us keep operational. In addition to that, we've been working very closely with both the county, the state public Department of Health, as well as other federal resources, and have additional resources that they are going to be able to provide to us to help us maintain operations.
Which of your facilities are providing testing? Which facilities?
Thank you for that question. So at this time, and I would like to really make sure that we stress this to all of those that are listening, we are not providing testing to individuals who are just curious or who just want a test. For those individuals that are having symptoms, we again ask that you call ahead of time to see whether or not you might warrant an assessment and whether that assessment might then lead to us testing. We do have ability to test, of course, in our hospitals, working closely with the state and the CDC for that. That's been in place for some time. We also have some limited ability to test those that screen appropriately, who have appropriate symptoms through CDC guidelines at other points of access. So that includes our emergency departments, our urgent care, and our clinics. We would again ask for individuals who feel like they might need that to please call ahead. If you feel that you need it when you arrive on site, please mask so you do not infect anybody else. And please know that the criteria for screening continue to change on a fairly regular basis. And we will inform the public, and we will, of course, do the appropriate assessment and order the tests as appropriate per those screening guidelines.
That's because there are a limited number of tests so far. You want to be careful with your supply?
Absolutely. So there is a limited capability of testing both within the United States as well as within the state of Arizona. We continue to work very closely with the Public Health Department at both the county and the state level. And as we've mentioned earlier, we expect that we'll have additional testing capacity later this week. And when we have that, we will certainly make sure that we make that known.
And real quick, because this is new, the old tests we have don't tell us whether someone has COVID-19. A new test needs to be created. That's why we don't have enough.
So COVID-19 is a novel virus, meaning that the world has not seen it prior to this time. The type of testing that can detect COVID-19 has been in development. In addition to that, some of the screening criteria that we've put into place are also to rule out things that are common during the season as well, influenza and other respiratory diseases. The testing that is available to us, both through the CDC and the state and now through commercial testing, has been developed specifically to be able to test for this specific virus.
Are you using the commercial labs tests or the ones the state run through the CDC?
So we're using a combination of tests for those patients that meet criteria. We're working very closely with the Public Health Department. Inpatients, for instance, are tested through the state and have been tested through the CDC. Commercial testing has become available, and we're utilizing that in our other ambulatory spaces. And in addition to that, while we've been working with the both county, state public health department, as well as other federal resources, we do expect later this week to have more widespread testing available for those that meet criteria. We'll make that announcement when we're ready.
What do you mean more testing capability? What percentage or what number?
I don't have numbers to share with you today. We've been working with both the county and the state departments of health as well as other federal resources to get additional test kits as well as to stand up additional ways by which we can get that commercial testing done. We expect to have an update for you later this week.
And you mentioned when people have been directed to come to a clinic that they should wear a mask. Other states have been having people come to a back door and the hospital has provided the mask. I don't have a mask at home, so how is someone supposed to do that? And have you considered the back door option?
Yeah, thank you. So I'll answer that two-part question. So in all of our entrances, whether it be a clinic, an urgent care, an emergency department, or even our entrances to our hospital, we provide kiosks with signage and masks that are available for individuals to mask immediately upon entry. So we don't expect individuals to have masks in their home. As far as alternative entrance ways, that is why we ask individuals, if at all possible, to call ahead of time. We are utilizing some additional pathways for those individuals, if they're pre-identified, to come through some additional alternative entrance ways into our clinic if we feel that situation warrants it. As I spoke about earlier, as we have additional ambulatory testing capability, we'll make those details known, and certainly that's going to include not coming to places where our clinics are already in place.
Ambulatory is like a drive-through test.
When we have those details of what exactly that setup is, we'll release those details when we're ready.
You guys have several numbers on your website. What number are people supposed to call?
Thank you for that question. Can I just refer to my document here? So the Arizona hotline for the Banner resource is 1-844-542-8201. In addition to that, we do have information about COVID-19 available to the general public by visiting our website, which is bannerhealth.com.
Say the number again.
1-844-542-8201.
And that number is the state health